Today we are looking at the disorders of the spleen. So pay attention as we are going to explain first the anatomy of this spleen so that we can able to understand this physiological function before we can see how it can be impaired in terms of the way it functions when you are looking at the anatomy part of it. So we are going to start looking at these disorders that affected the spleen, let alone after having going through the functions of the spleen itself. So we are starting over. So the spleen, it is just the organ that is going to be found in the upper left side of the abdomen, and its function mostly it filters the blood to remove the substances that can be detrimental within the circulatory system. So we are saying that it is the organ or the lymphatic system which plays in the immune system, and it is found within the upper left sided of the abdomen. So this spleen, it helps in the immune system by destroying the bacteria and by opsonization. So when you say opsonization, you're just actually talking about the process of opsonanis. These opsonization, the way they work, more like the substances that are found in the extracellular part of the body. They are actually the protein that are going to be found in the extracellular part of the body that binds to the substances within the cells and induce the phagocytosis so that all the foreign invaders can be attacked by the body, and so we're saying it helps in the immune system. And we're saying that approximately this spleen, it stores about 33% of all platelets in the body. We know the platelets, these are the substances or the cells that are essential in the blood clot formation. So here we have seen the anatomy of the spleen. I've just added this diagram so that you can able to see where actually the spleen is located. So if you see on the right side of this diagram, we can see the spleen posterior to the stomach, and it is just adjacent and inferior to the diaphragm. So this is where we are going to find the spleen. And here we have just shown the enlarged diagram of the spleen, so we can see that there's actually the relationship between the spleen and these other structures that are found in the abdomen, like the liver, the gallbladder, the stomach, and the intestines, also the pancreas. So there's a relationship between these structures. Straight away, so we're saying that the spleen is a useful organ, but not primarily essential, in a sense that a person can able to do even without the spleen when it has been removed. There are some of the disorders that we are going to talk about in our lesson for today that are going to show in which the spleen can be removed through the process of a splenectomy, but still the person can able to survive even without the spleen. Those conditions include the haemolytic anemia and thalasaemia that can be detrimental to the spleen itself, in a sense that it is going to impair or alters the function of the spleen that can end up for the spleen being removed. So we're saying that only the major thing, what happens when the spleen is removed, which helps in the immune system, the person would require to be vaccinated over the problems that the person can face if without the spleen. So that's why we are saying that it is not actually an essential organ. It can be removed whilst life continues of the person. And some of the functions of the spleen, it works as a hematopoietic media, or it works in the hematopoiesis. What do we mean by this? The production of the bloody cells, and it is mostly in fetal life. When the child is still small, at the fetal age, when it is still a fetus within the womb, the person will be having the blood production within the spleen. But as the person grows, this hematopoiesis takes place within the bones. Another function, it is filtration of the blood. As the blood is circulating within the body, having that this spleen is a lymphatic organ, it will keep on filtering the blood to detect the foreign invaders that can be detrimental within the circulatory system. And when they are found, they are going to be trapped by the spleen and being destroyed. That's why we are saying that it is actually very functional organ. It is very essential. And also, thirdly, it is also functioning immunological functions, in a sense that the spleen is an important site of for affecting both cell-mediated T cells and B cells, which are your moral immunity. In this case, we're just talking about the immune system. They work in the immune system in the sense that they induce the mechanism of T cells and the B cells, which are the lymphocytes that are essential in the fighting against foreign invaders. And it also works in an endocrine system, where it stimulates the production of red blood cells, and it also suppresses or depresses the production of these other blood cells. But red blood cells, it is very essential connective tissue which transports the hemoglobin, which carries oxygen with it, so as all the cells to be oxygenated or to be supplied with oxygen and other nutrients. So that's what the spleen works, or those are some of the functions of the spleen. But having said that, today we are looking at the disorders that affects the spleen. That has been just the anatomy part, anatomy and physiology of the spleen. Now straight away we are going to start talking about the disorders that affects the spleen itself now. So the first disorder, or it is the abscess of the spleen. The abscess, it is just the accumulation of the pus or accumulation of infectious fluid within the organ that can be described. So in this case, we are saying that this abscess of the spleen are just the accumulation of the fluids that are infectious to the spleen. And what can cause that? It is the presence of the bacterial infection from the distant cells. It could be the spleen itself that can be infected by the bacteria, or other distant cells like those other organs that are found within the abdominal cavity. Having said that, there is a relationship between those organs, so when one organ it is infected, there are possibilities whereby the spleen can also get that infection. For example, an infection from the pancreas, which could be the pancreatitis, or maybe resistant endocarditis, can also spread its infectious agents to the spleen and become infected, forming the abscess of the spleen. So the likely pathogens that can be the cause of this if infection of the spleen or the abscess formation of the spleen are determined by the original focus. Sometimes what can cause the infection at a particular point in time, that will be the causative agent. Sometimes the underlying disease, just like we have mentioned, if it is a pancreatitis, that will be the cause. But there are some of the likely pathogens that causes the abscess of the spleen. What are those pathogens? Here they are. Mostly it is gram-negative bacilli like E. coli, because it is highly present. This bacteria, it is actually the normal flora of the body, but it comes as an opportunistic infection, whereby if at all the body's immune system has been suppressed, this E. coli can produce or manifest an infection, which is an opportunistic infection. Then you can also talk about the Staphylococcus aureus. These are also normal floras of the external part of the body, but when something happens whereby they find themselves inside the body, they can also cause an infection that can causes or leads to abscess of the spleen. Also the streptococci and entterococci, mostly these are the pathogens that affect the respiratory tract. So as the infection it is advancing, there are possibilities whereby the distant cells are going to be affected. Remember, respiratory tract, it rests on the diaphragm. That's where the diaphragm, that's what demarcates the thoracic cavity from the abdominal cavity. And having said that, the abdominal organs, they are in relationship with the diaphragm which is in relation with the thoracic cavity. When there's an infection within the thoracic cavity, the high chances of having that infection to the posterior or inferior part, which is the abdominal cavity. Hence, the spleen is just one of the organs that is found in the abdominal cavity that can also be infected. Then there's the candida species. Mostly this comes as an opportunistic infection. They are fungal infection, can also manifest or infect the spleen. And we also have mycobacterium. Mostly mycobacterium is also another example of respiratory infections, like mycobacterium tuberculosum. that causes TB. So these are some of the common causative organisms that can lead to the formation of the abscess or the spleen. Now, what are the risk factors? Having looked at the causative agents, there are other risk factors that actually influences the occurrence of this infection. So, for example, neutropenia can cause this. What is neutropenia in this case? Neutrophils are the granulocytes type of white blood cells that are essential in the phagocytosis. So in this case, neutropenia, we are just talking about the reduced amount of these neutrophils. So when they are reduced in its amount, it means that the immune cells are going to be impaired or are going to be reduced, which suppresses the immune system and imposes the person to the likelihood of developing abscess over the spleen. And also chronic corticosteroid use that have got a negative impact or that causes the inflammation and also make a person being prone to abscess formation of the spleen, as well as immune suppressed clients due to some of the underlying diseases who are suppressed. They are also going to be vulnerable to the formation of the abscess. And the men from 6 months to 90 years old and other clients with sickle cell anemia and diabetes are also predisposed. Just like we have said, the target is those who are immunosuppressed, because if you have noticed, much of the causative organisms that we talked about, they come as an opportunistic infection. Hence, when a person is suppressed with the immune system, it is going to increase the likelihood of this person developing the abscess or the spleen. The possible signs and symptoms that you are going to see in the person who is having the abscess of the spleen are the generalized abdominal pain, because we said that mostly you find that the spleen abscess are going to come due to the underlying diseases or infection of the distant sites or the cells. So you find that there are a number of organs that are going to be infected within the abdominal cavity. So there will be the generalized abdominal pain. The whole abdomen is going to manifest with the pain. There will be fever due to the infection that can be current that induces the antibody antigen reaction. The tenderness due to the fact of an inflammation, so there will be that pain that will be produced, more especially if at all this spleen it is palpated. And there will be splenomegaly, which is said to be the enlargement of the spleen. Remember, infection results in inflammation, and this inflammation is an accumulation of fluids because of the dilatation of the blood vessels. So the spleen is going to swell and accumulate the fluids within it, so that it is going to enlarge as you are palpating it. Then there will be diaphragmatic irritation, which may be present as a left shoulder pain. Diaphragmatic, what we're talking about, diaphragmatic in this case, we are talking about actually the inflammation of the diaphragm, because we said that this spleen, it is just inferior to the diaphragm but adjacent to it. So when it is infected, there are high chances of the diaphragm also to become inflamed, and it is going to result in the irritation, more especially as the person is breathing in and out. Due to the contraction and relaxing of the muscles of the diaphragm, there are going to be this irritation that we're talking about, and this at the end is going to lead to anorexia, which is the loss of appetite. Then it will also lead to malaise. Malaise is going to come from the fever, which is the fatigueness and the weakness of the body due to the inflammation that is taking place because of this abscess of the spleen. What are the possible investigations that you are going to take in order for you to rule for the presence of the abscess within the spleen? First thing, you are going to take the history from the patient. Having looked at the signs and symptoms, you find that we talked about the pain that is going to be felt within the abdomen. So you are going to get the history from the patient about how they are feeling. They are going to explain about the pain, they will complain the pain, they will complain about the loss of appetite and their fever and the like. So this is going to show you that actually the person might be suspected of having the inflammation of the abdominal organs, which one of them would be the spleen. Physical examination, you are going to palpate, which is going to show the enlargement of the spleen, and we are going to take a chest x-ray or abdominal x-ray. So the chest x-ray can show the presence of an infection within the thoracic cavity, which can be spread to the spleen, And also abdominal x-ray, it is going to show the enlargement of the spleen itself. You can also do the CT scan, which is going to show the size of the spleen and the fluid levels that can be accumulating within the spleen due to the infection or an inflammation that is current present. We are also going to do the blood culture to rule for the presence of microorganisms that can be the causative agents of an infection, and this infection can be the cause of the abscess or the spleen, just like we have talked about those causative agents. So the presence of these causative agents is going to show an infection, and we are going to suspect for the spleen abscess. Also, you are going to do the biopsy, which is actually the sample. You're going to get the sample from the abdomen or aspirate the abdominal fluid that is going to be cultured or being viewed at the microscope to rule for the presence of those microorganisms that can be causing an infection. So these are the possible investigations that you are going to carry in order to rule for the presence of the abscess of the spleen. And in terms of the treatment, you are going to give the antibiotics, in a sense that we said that what can cause this abscess of the spleen is actually the microorganisms that are pathogenic in nature, like those bacteria. So you are going to give antibacterial, which are antibiotics, so as to eradicate their presence and stop the abscess formation. Also, when the infection is severe of the spleen, in a sense that it cannot be repaired even with an aid of the antibiotics, then splenectomy, it is going to be performed. Splenectomy, in this case, it is just a surgical removal of the spleen. Remember, we said that a person cannot die without the spleen, but rather can only require some other vaccination or immunization so as to make him or her be able to withstand some of the infections that can come as a result of lacking this spleen. And sometimes, if at all there's just this accumulation of the fluids, you can actually withdraw or aspirate these fluids from the spleen with a guide of the CT scan that is going to direct you about the mechanism and the procedure that you are taking. The possible complications that can come as a result of abscess of the spleen are pneumothorax. Remember, we talked about the relationship between this spleen and the organs in the thoracic cavity. And the pneumothorax, in this case, we're just talking about the accumulation of air within the lungs, or rather within the thoracic cavity. So this can be caused due to some of the procedures, like surgical procedures that can be performed in an instance of the spleen abscess. This can lead to pneumothorax, and when pneumothorax occurs, atelectasis may occur. Atelectasis, in this case, it is just a collapse of the alveoli that can be due to the pressure that it is receiving, because we said that the infection of the spleen can also lead to the irritation of the diaphragm. The diaphragm, when it becomes inflamed, it is going to compress the lungs, and when the lungs are compressed, it means that the alveoli are going to decrease in terms of their size. They have to accommodate the air. At the end, it may result to the atelectasis. It can also lead to life-threatening hemorrhage, because we are saying that there will be the seeping of the fluids, there will be edema that is going to be formed, and in an instance whereby the rupture occurs due to the severe inflammation, there can be the life-threatening hemorrhage. And also, complications that arise will be the left-sided pleural effusion. There will be pleural effusion, the accumulation of fluids within the pleural cavity, which is in the lungs, due to the inflammation that can be spread there as a result of the relationship that is there between these organs that we're talking about. Another complication will be subphrenic abscess. Subphrenic abscess, in this case, we are talking about all the organs now that are just below the diaphragm. Because of the relationship that is there between those organs with the spleen, you find that an infection of the spleen, it is going to be spread to those other organs, hence making them also to have accumulation of infectious fluid, which is the abscess in this case. Also, it can lead to perforation of the stomach due to the fact of the spread of an infection. Also, these other organs can be perforated, even the stomach itself. It can also cause the pancreatic fistula. just like we have seen in the anatomy part of the spleen. We have seen that the spleen, it is actually just adjacent to the pancreas. So even the pancreas can be perforated, forming this fistula. And we can also have a post-splenectomy thrombocytosis. Due to the fact of abscess formation within the spleen, it may call for the splenectomy. Now, there are complications that may arise due to that, like post-splenectomy thrombocytosis, which is actually the aggregation of the red blood cells due to the fact of the surgical procedure that can be done. And you have got the pneumonia, which will come as a complication. Pneumonia is actually an infection of the lungs themselves. So friends, this has been just one of the disorder of the spleen. Remember, we're not talking about the number of disorders of the spleen. So abscess of the spleen, it is one of the disorders of the spleen. I hope you have understood this. Let's continue to the next disorder of the spleen, which is splenomegaly. Splenomegaly, we talked about it under the signs and symptoms of abscess of the spleen, and also in this case we are saying that it may stand as a disorder on its own. And the splenomegaly, it is sometimes said to be hypersplenism. Why is it called like that? Because actually this enlargement of the spleen may come due to the workload that can be imparted on the spleen itself. So splenomegaly in this case is nothing but the enlargement of the spleen that can be more than 12 centimeters. The normal size of the spleen is actually 5 inches or 12.7 centimeters. So when the spleen increases its size, its length to more than 12, it is going to be concluded as being splenomegaly. So we are saying that in this disorder, the spleen is not going to be able to function its role. It is not going to play the phagocytic function. Also, the blood production, like we have said, being the hematopoietic media, it is also going to be impaired. It is not going to be able to play those roles. And the spleen temporarily, it will start distracting or destroying the normal platelets and the red blood cells because of its alteration that is going to result with it. What could be the possible etiological factors to this? We are saying that most of the cases of splenomegaly, its cause is idiopathic, or meaning that it is not primarily known. But sometimes it may come as a result of an infection that can be present, like the abscess that we have already talked about, the endocarditis, chronic tuberculosis, malaria. All these are some of the disorders, systemic conditions that can cause actually the splenomegaly due to the workload that is going to be imparted onto it. We've got types of splenomegaly. First one is reactive splenomegaly that actually comes due to the acute or chronic inflammation that can be present, and this can be caused even because of underlying diseases. But for example, if these the inflammation that can be present and persistent, it can lead to reactive splenomegaly. Another type of splenomegaly, it is congestive splenomegaly. Just from the term, this shows that there is actually the congestion within the spleen that is taking place, and this can be, for example, caused by the congestive cardiac failure. This can result in congestive splenomegaly. That's why it is sometimes called hypersplenism. It means that the function of the spleen, it is being overly produced, hence making it to swell or to enlarge in its size. So we're saying that mostly with this one, it can even result in from the left-sided heart failure and portal hypertension due to cirrhosis. We discussed about just cirrhosis, so I guess we all understand what is this cirrhosis, which is actually the damage of the liver parenchyma. And when this happens, it means that there will be hypertension of the blood because the liver is also congested, the heart is congested, hence the spleen function, it is going to be increased, leading to congestive splenomegaly. The possible signs and symptoms of a splenomegaly could be abdominal pain, because this spleen, it is within the abdomen. So due to the inflammatory process, there will be abdominal pain. There will be chest pains that can be spread to the thoracic cavity due to the relationship that is there between the spleen and the thoracic cavity. There will be the back pains, There will be signs of anemia due to accompaniment of cytopenia, like pallor. So this is going to result due to the fact that the spleen, we said that when it is altered in its function, it will start destroying the red blood cells. So as it is destroying the red blood cells, anemia would result, and there will be palpable left gutted abdominal mass. There will be, in this case, what we are talking about, it is the left abdominal mass. There will be abdominal mass that is going to be formed. This is actually the abnormal growth that is going to be shown due to the enlargement of the size of the spleen. So that's what we are talking about in this case when we're saying the palpable left abdominal mass. Investigations that are going to help you in order to diagnose the presence of the splenomegaly. It is physical examination that is going to show for the presence of the enlargement of the liver. When you palpate, you can also take the ultrasounds to confirm your diagnosis. Ultrasound actually are going to show the detailed image of the enlargement of the spleen. And other investigations is just like we have talked about in the spleen abscess, like taking the history, taking physical examination, just like it's always been shown here. You can do the CT scan and all those other investigations that we talked about. Then also the treatment will be just like we have said in the abscess of the spleen, because sometimes in a severe case, the splenomegaly, or rather splenectomy, it is going to call for retention. So most of the treatment, it is just the same as that of the abscess of the spleen. So this also has been an example of one of the disorders of the spleen. Okay, so another condition or disorder that affects the spleen, it is a rupture of the spleen. Rupture of the spleen, in this case, it could be just the capsule of the spleen outside, or the spleen itself, it is going to rupture because of some causes. So that's what we call the rupture of the spleen. Now, what could cause the rupture of this spleen? Sometimes it can be caused by some accidents that can be occurred, like the knife wounds. Maybe someone pierces the knife in the abdomen, and then it passes or penetrates through the spleen. This can cause the rupture. Or maybe the severe blow to the spleen, or the gunshot. Or these are some of the objects that can cause the rupture of the spleen. Sometimes accidental tearing of the splenic capsule during surgery of or neighboring organs. Sometimes we talked about a number of disorders that affect the spleen. So as the surgical procedure is taken to manage the problem that affects the spleen, you'll find that it gets to be ruptured accidentally. Or sometimes let's say it is the pancreas that is being worked on due to the problem that it may develop. So as the surgeon is repairing the pancreas, you find that accidentally the spleen ends up acquiring an injury that makes it to rupture. Or sometimes there are just the diseases that can be present, like we have already said, the disease of the spleen itself, and other systemic infections like malaria. Due to the inflammatory process that is going to be taking place, it is going to make the spleen more tortuous and prone to rupturing. Hence, we are saying that these could be just type causes of the rupture of the spleen. So here we've got the visual aid of an extracted spleen, and we can see those openings or the rupturing that has been sustained. And in this case, a deadly and an emergency condition when at all the patient comes with such kind of the condition. So now, what could be the signs and symptoms of the rupture of the spleen? 1. There will be hemorrhage, signs of hemorrhage. That includes hypotension, tachycardia, cold, and the clamp skin. So that's why we have said that it is actually an emergency, because hemorrhage may lead a patient into shock that can result into death. So hemorrhagic shock can come as a result of the rupture of the spleen, because blood will be leaking, there will be internal bleeding. Hypotension in this case is actually the reduced blood pressure due to the fact that the large volume of blood has been lost. Tachycardia will be the increase of the heart rate, so as to try to compensate the loss that has incurred, to try to send the nutrients and the oxygen to the vital organs. And cold and clammy skin will come as a result of the reduced of the blood flow within the skin itself. There will be pain in the upper left abdomen, where we find the spleen. There will be the tenderness when you touch the upper left abdomen, because that's where the spleen is. So due to the inflammatory or an injury that has occurred, there will be pain. And the left shoulder pain will be also occurred due to the involvement of the diaphragm. And the confusion, lightheadedness, and dizziness is going also to occur due to the fact that there's a reduced amount of the blood that is reaching the vital organs like the brain itself, due to the loss of the volume of blood due to the rupture that could occur. So those are some of the possible signs and symptoms that you can see. And note that this is an emergency. Even the treatment, it is emergency. So we're saying that the treatment of the rupture of the spleen actually depends on its severity, the severity of the injury. How much is the spleen bleeding? Is it a life-threatening situation, or maybe it is just a minor injury that has occurred that can be managed medically? So if at all it is confirmed that the problem, it is a major problem that could lead to the critical condition of the patient, then splenectomy, it is going to call for retention, so as it will prevent the hemorrhagic disorders. And if the injury of the spleen, it is not that much severe, then it means that only minimal invasive procedures are going to be taken, and the spleen of the patient is not going to require to be removed, but hence just medical treatment and some of the form of invasive procedures are going to be used in order to manage the bleeding. So these are the investigations that you can take in order to rule for this rupture of the spleen. First, you can do physical examination. As you are palpating, the patient will show the tenderness, and also due to the inflammation that can occur, it also enlargement of the spleen can be demonstrated. The blood tests can also be checked to show the amount of cells, the concentration of the cells within the blood. So the higher concentration of the cells is going to rule for the presence of the blood that is being lost from the spleen due to the fact of the bleeding that is occurring. Then another procedure that you can take, you can check for blood within the abdominal cavity. You aspirate the fluids from the abdominal cavity, and you are going to find the presence of blood just within the cavity. So this one is going to show that actually there's an organ that is leaking blood, which in this case could be the spleen due to the injury that can be sustained. So this is going to show that actually there's a problem that is happening or occurring. Then lastly, you can do the imaging test of the abdomen, like you can take for x-ray, that is going to show the accumulation of the fluid due to the fact that blood is being lost from the ruptured spleen. You can also do the CT scan of the abdomen, that is going to demonstrate the detailed images of the rupturing of the spleen, and also the presence of blood within the peritoneal cavity. And the possible complications that can be seen in an instance of the ruptured spleen, it is complications of surgery that can arise, like delayed bleeding. There will be bleeding that can lead to hemorrhagic shock and other abnormalities like anemia and tachycardia, hypotension, all those problems that we have talked about, so will come as the complication. And also there can be the cyst formation or even leading to death. This cyst formation are just accumulation of the fluid within the surface or the capsule part of the spleen in this case, but also it can lead to the death of the patient due to the severe loss of the blood. So friends, this has been for today. Thank you very much for your attention. So we have been talking about the spleen. We talked about the physiological function of the spleen. We have talked about the disorders of the spleen. We started with the abscess of the spleen. We went on talking about the splenomegaly, and we also discussed on the ruptured spleen. So these are just some of the major disorders of the spleen. In the next lesson, we are going to talk about splenectomy as a topic on its own. Quite alright, it is the surgical removal of the spleen. But what is splenectomy on its own? The indications and the possible complications that may arise due to the fact of the very splenectomy. For today, thank you very much.